Welcome to another AR Connect expert discussion. We're here live on the floor of RSNA, and I'm Kieran Anderson, Vice President and Group Publisher here at Applied Radiology. Got the pleasure today of sitting here with Rob Fabrizio, who is the Director of Strategic Marketing, Modality Solutions at Fujifilm Medical Systems USA Incorporated. Rob, thanks for joining us.
Hi, thank you.
Today we're going to hear from you about a few significant updates with artificial intelligence from Fujifilm. So thank you for taking the time, and let's get right into it. So Rob, why is Fujifilm pursuing applications in artificial intelligence?
So we believe that we can apply AI technology to our existing portfolios of medical imaging and really benefit patient care in a lot of different ways, improving workflow, improving clinical efficiency, and improving outcomes.
Can you talk a little bit about some of those applications that you're pursuing, particularly as it relates, say, to diagnostic imaging?
Trauma patients coming in for a chest x-ray, there's a high rate of missing pneumothorax in those images. And our AI technology is being designed to have a very high degree of accuracy in detecting pathologies such as pneumothorax. And it will provide a heat map display to the technologists and the physicians to identify areas and help hopefully prevent pneumothorax from being missed. Another area we're focusing on is the operating room. So we're focusing on designing for detecting gauze in the patient. So as you can imagine in surgery, gauze is typically counted, and a lot of times they take an x-ray. But in many cases, when gauze is left behind, there was an x-ray performed and it was missed. So our AI technology is being designed to detect that also with a high degree of accuracy. And we have sample images and some very amazing results so far. The next area is for workflow in general radiology department. So with a camera built into the collimator of the x-ray system, we can sense the patient position. And when the technologist has selected an exam, the AI technology can detect the patient's orientation, the body part, and identify if the correct position is in place, if they're in the correct orientation, if they've chosen the right knee instead of the left knee, or PA instead of AP. The system will give them a warning and ask them to double check their work.
What benefits can we realize today from some of these AI applications that Fujifilm is developing?
So obviously from a lot of the things I mentioned, there are a lot of these types of things such as pneumothorax and gauze or other objects being left in the patient positioning. A lot of these mistakes can cause serious consequences for the patient, for the hospital, for the staff, and affect patient experiences. And then ultimately, we are focused really on the patient experience and improving lives.
Well, Rob, this is very exciting stuff that's going on at Fujifilm as it relates to AI. It's certainly a hot topic, and I'm glad to hear that you all are making some advancements in this area. I'd like to thank you for stopping by the Applied Radiology booth to speak with us here at RSNA.
Thanks.